Yeah, good afternoon, friends. Thanks for this wonderful opportunity to have a good talk about the self monitoring of blood glucose awareness and where are we currently standing in 2022. It has almost been more than 2 decades since the blood glucose monitoring devices were available for the patients to monitor the blood glucose at home. With the help of the self blood glucose monitoring, we were able to keep the patient's blood glucose levels in very stringent control to avoid the hyperglycemia and to prevent the micro and macrovascular complications. One of the major importance of the blood glucose monitoring at home is not only to arrest the escalations of the blood glucoses, but also most importantly is to prevent the hypoglycemia of a patient. Prevent the hypoglycemia, especially in elderly people and type 1 diabetics. The most concern for many of our doctors is we don't want a patient to go into hypoglycemia, because hypoglycemia becomes again an hospital management. So a patient has to, if he identifies that he is in hypoglycemia, then he can immediately respond to it and take some kind of a carb or a glucose and bring his blood glucose levels to a safer zone. So in this manner, with the help of self monitoring of blood glucose at home, we are able to achieve very good control of diabetes for any given patient. And we all know that having a good control of diabetes means that we can prevent brain stroke, prevent cerebrovascular disease, prevent cardiovascular disease, diabetic nephropathy, diabetic neuropathy, and many other symptoms and situations can be prevented, like retinopathy or even dental conditions, vascular conditions, and you can prevent foot amputations, prevent gangrene, and so on. So management of diabetes, nowadays it is most often a patient-centric approach. Today we are not treating anybody in a generalized condition. We are trying to go to a patient-centric approach. That means we are able to customize the treatment to suit to any patient given needs. Like for example, when we have a patient who is 35 to 45 years of age, an youngster, we are here trying to bring a stringent diabetes control here in such a patient, trying to achieve lesser than 7 HbA1c, close to 6.5, so that in the long run, in the decades to come, we can avoid a complication like micro or macrovascular complication in this patient. But at the same time, when we come to a geriatric patient, we try to achieve A1C less than 8 and slightly above 7, so that by this manner we can avoid a hyperglycemia in these patients. And when it comes to gestational diabetes mellitus, we are also able to bring the blood glucose levels in such people very close to near normal blood glucose levels and avoid whatever can be done. And also, not only this, we are also able to restrict the carb intake for many patients by checking the prandial excursions and arrest the prandial excursions by low intake of high glycemic foods, or in other words, they can take low glycemic index foods. So in such a way, and also it's not just the doctor alone who is trying to treat the patient. Now there is a supportive diabetes care team consisting of a psychologist or a person who can manage the stress of a given patient. I mean to say, offload the stress of a given person, and then sit and talk to him about the concerns of diet, whether a patient has, what kind of a craving he has, and what is the kind of a work he is doing. Is he working during the day or night, or he is obese? If a obese person, then we want to cut down the weight which is undesired. So we want a desired weight loss for overweight patients. In a similar fashion, if a person is less weight, so you want to bring up his weight by increasing his muscle strength. So there we can allow some kinds of foods that can build up his muscle mass and then keep him in a good condition, an anabolic condition we call it, when he is in a positive status. Usually when a patient is having very high blood glucose levels, they tend to lose weight. So when you bring down the blood glucose levels to a very normal readings, then the patient will tend to lose less glucose in the urine and he gains the weight back. So these things are all very necessary. They're not generalized to all the population. So we decide which person has to gain weight, which person has to lose weight, which person has to be weight neutral, and also what kind of a person in the past had a nocturnal hypoglycemia and how to prevent such nocturnal hypoglycemias. And apart from this, the socio-economical condition of a given patient, is he affordable or not affordable? In case if he is not affordable, then we can predict or we can pick up certain drugs that are low cost for such a given patient and then modify his requirements, and even we can give him an effective testing tools, methods, so that he doesn't waste his resources, he can save his resources and stuff like that. So the four important pillars of diabetes treatment, as we all know, it is definitely the first is diet, and then the exercise plan, and then the medications plan, and then of course the monitoring. Without monitoring, we can't decide upon any of the just said factors, because if a patient is taking very low diet, then he may go into hypoglycemia, or if he is taking high carb diet, he might go into hyperglycemia. In a similar fashion, if a person is doing exercise extensively, then he might again experience a hypoglycemia. Or if he is not at all doing any kind of reliable aerobic exercise, then insulin resistance may be higher side. And because of high insulin resistance, the medicines required by him, either the tablets or the insulin requirement might be more. So we need to monitor here. Again, medications. When a patient is having high blood glucose levels, the doctor gives him more medications, whether it is tablets or insulin. And then when the patient comes to good glucose control, then the need of the medications comes down, which have to be adjusted. And further, when the patient is adopting good exercise and diet, then further his blood glucose may drop down. So the doctor has to again reduce the medications. So anything and everywhere, monitoring is very important. Without monitoring, it's very difficult to manage a given patient. Like, to compare, for example, when you are on a road where the speed limit is of 100, so you shouldn't go beyond 100, because it comes into excess speed and you might be fined because you are exceeding the speed. And in the same zone, there might be a thing, you should maintain a speed of above 80. You shouldn't go down below 80. So in an express highway, you have a speed limit of above 80 and 100. So you should be traveling in the same zone. So what you do, you if you have an option of cruise control, you put it in cruise control. That means you are monitored. You are automatically monitored. Or at least you watch your speedometer to see that you don't go up above 100 speed, or you don't fall below 80 speed. In a similar fashion, without monitoring, one cannot be in good diabetes control. If I have a time, I will just quote an example. Yesterday, Sunday, I had a patient who is a doctor coming to me with a 14 HbA1c percentage. Can you believe that? 14, a doctor, physician. And then I asked her, respected ma'am, when was the last time you checked your blood glucose levels? Doctor, I checked it just 2 years back. Ma'am, what happened? Doc, we are very busy, catering to the COVID patients. Ma'am, I respect that, but I don't want you to become a patient of, diabetes. You can be a person with diabetes, but I don't want you to become a patient of diabetes. No, doc, how do you describe it? Ma'am, see, you saw I had been consulting other 10 patients. Their blood glucose levels are close to 6.5, below 7, and none of them had any kind of a complaint in diabetes. They just came for a casual doctor consultation because it was due. And when they came, they showed me their SMBG chart. We had a review of their diet plan, and addition or subtraction or maintenance of their medicines was done. So they were all clients for me, and I was just guiding how to manage their diabetes better. But for you who came with high blood glucose levels, you came as a patient, and now I am a doctor for you now. So then I was able to convince the doctor to take insulin at least for some time. And then once their blood glucose levels come under beautiful control, then we can discuss about what we shall be doing about the insulin, wean off them from insulin or whatever it is. So I was lucky that the doctor immediately agreed for whatever I proposed. And I also said you should be using your glucometer. Your glucometer is not meant to keep it in your showcase. You have diabetes? Yes, I have diabetes. Do you have a glucometer? Yes, I do have a glucometer. वो नहीं है. You have to use the tools. It's not a diamond necklace. You buy it and then you show it to all your friends and then you keep it in the bank locker. And you don't know when you'll be using it for the next time. So a glucometer is a tool. It's to be used. It's like a knife in your kitchen. You use it to cut your vegetables or do something, right? So it is a tool to be used, and don't misuse it. Don't keep checking for every small reason. It makes you panic. You can't be able to understand yourself better. Do it in a rational manner. Do it as per your doctor's suggestion, and do it as per your medical requirement. Just don't keep checking it for very, very often. That is also one of my advice to many of my patients. Fine. I hope I'm not too slow with this, right? So the blood glucose monitoring. Blood glucose control is critical for managing diabetes and preventing diabetes related complications, as we all know. To name a few: cardiovascular disease, retinopathy, nephropathy, neuropathy, and stuff like that. And regular monitoring of your blood glucose levels is very important for some of the decisions to be taken either by you or by the doctor. And testing your blood sugar lets you know whether you are on target of blood glucose levels or not, or whatever. And not only that, people who travel, they should and must carry their glucometer with them so that they can really understand where are they in their terms of diabetes management. So a good control of diabetes is when you have an HbA1c less than 7 according to the ADA and less than 6.5 according to the IDF. And before meal, at blood glucose of 80 to 130 milligrams per deciliter according to the ADA, but whereas IDF has a more stringent levels less than 110 milligrams. So stringent means it's good for a person who is less in age and who has a long life to live. And after meal, ADA says have it below 180 milligrams, whereas IDF says below 140 mg is better for a given patient. So I would look at ADF for senior patients and I would look at IDF for younger patients. And HbA1c. HbA1c is known as glycated hemoglobin, and its average blood glucose levels for the last 2 to 3 months. It's measured in terms of percentage and then measure at least every 3 months when glycemic targets are not being met or treatments adjusted, and measure every 6 months at least. It's very important. So you should also know what are the factors that could affect one's HbA1c. So there are several factors that can falsely increase or decrease one's your HbA1c result, including persons with kidney failure, liver disease, or severe anemia when the red blood cells are very low. A less common type of hemoglobin that people of African or Mediterranean Southeast Asian people do also have something like thalassemia or sickle cell anemia. I do have a patient of sickle cell anemia. It had been very difficult to understand her HbA1c. So nowadays what I'm doing in her is I'm using a CGMS, continuous glucose monitoring system, a small sensor which is placed, and every 5 minutes the blood glucose levels are picked up, and every 15 minutes the blood glucose levels are saved in it, and it works for 14 days. So we can have a good picture about what's actually happening in this particular person. And also there are certain medicines including the vitamin B12, vitamin C, opiates, and some HIV medications, blood loss or blood transfusions, and early or late pregnancy. There can be some small differences in the HbA1c. Don't worry about this. Your doctor will take care about all that. But most important is you don't panic when you when a patient has a differences of opinions. And not only that, sometimes some patients go and check their their HbA1c in 2 different labs, and there could be a variation of 1% from lab to lab, and patients get confused about this 1% and they keep scratching what to do. So please leave this particular question to your doctor. I recommend to the patients, and wherever and whatever the doctor suggests to test, when the patient does that, it saves the patient time and money as well. So self-monitoring of blood glucose is testing that blood to check the glucose levels at home in people with diabetes. It is used to check blood glucose regularly to understand whether one's diabetes is in control or not. It gives a current and actionable reading, and SMBG helps to identify which foods are good to eat or not, and also it helps to individualize type and duration of daily exercise for people especially with type 1 diabetes or gestational diabetes. And not only that, we are now encouraging the geriatric population, patients or people with above age of 70. Resistive exercises for them helps in maintaining their blood glucose levels. It helps to reduce the insulin resistance, and in some patients whose insulin dose is going increasing steadily to keep their diabetes under control, if these people also follow resistive exercises, their insulin requirement is coming down or their medications levels are coming down. So especially in these people, it is very important to check the blood glucose levels, and it also helps to inform patients and the doctor how good and the prescribed medicines are working. And SMBG reduces the anxiety about increasing risk of hypoglycemia. Whenever the doctor increases some medications, especially people with long standing diabetes who had been having diabetes for more than 2-3 decades, whenever a doctor increases the medication, they feel that their sugars are going to go down. So we say, okay, please go home and check your sugar levels after 1 or 2 days. Once you check the blood glucose levels, you will be able to understand whether the medications are producing any hypoglycemia. In case if you see that the sugar levels are falling below the desired levels, you may reduce your insulin dose by 2 units or 3 units, especially the dose that is being taken at the night time. Or you can also reduce the tablets given to you during the dinner time to prevent the hypoglycemia. Usually many doctors mention which drug to be reduced in case of hypoglycemia. So SMBG is a fundamental component of diabetes care. So people with diabetes, it links between the diabetes education and understanding, glycemic assessment, behavioral changes, optimization of therapy, and the healthcare team and the SMBG. So here the impact of all these things is a metabolic, clinical, safety, quality of life, and even economical. It's also economical. Imagine if a patient goes into hypoglycemia and he goes into a super specialty hospital where he will then be admitted in an ICU and then the treatment will be started. But if a patient is able to early recognize a hypoglycemia and take a carb diet or take glucose, so immediately their blood glucose levels goes to normal sugar levels, and then they can prevent a hospitalization. So purpose of self-monitoring of blood glucose levels and Hpvc measurements. So HbA1c is characterized long-term glycemic control, whereas the SMBG characterizes the short-term glycemic control. See, sometimes unfortunately some patients are doing this online online tests where a person comes and does a big bunch of tests. They does test for more than lab test of 100, 180 where HbA1c is there and they don't have a blood glucose levels in the report. It's very pathetic. Or if they have a blood glucose levels, it's only random. You don't have a fasting and a postprandial blood glucose levels in majority of these online testing systems, because the person who comes to collect the blood, he doesn't want to come 2 times. They just only come once and collect the blood and go and give only a HbA1c or a random sugar report or a fasting report or a postprandial report. But as a treating physician, we need the fasting blood glucose levels to adjust the night doses, and we need a postprandial blood sugar report to adjust the morning doses, and also HbA1c to assess what has been happening in the past 2 to 3 months. HbA1c doesn't give you a blood report of that particular day or yesterday. So the HbA1c measures the changes in the long-term glycemic control, but whereas the SMBG helps to understand the current situation, and HbA1c gives information to determine overall efficacy of the treatment, but whereas SMBG gives us a day-to-day information, and also HbA1c helps the doctor to understand whether to start insulin or not, but whereas SMBG helps a doctor to adjust the insulin doses. And HbA1c gives feedback to the patient in terms of overall glycemic control, whereas SMBG gives day-to-day support. And we do also have an assessment of overall HbA1c. If a patient is having a HbA1c of 7, that means his past blood glucose levels is around 154. If it is above, if it is at 8, it means that the blood glucose levels are at 183. If it is above 9, it means the blood glucose levels are above 212. Like that. If it is below or around, if it is at 6.5 HbA1c, then it means the blood glucose levels are at 140. If the HbA1c is at 6, it means that his blood glucose levels on an average are at 126. So appropriate A1C management should consider both the fasting and the postprandial glucose, as just now I was mentioning, because we know that if the HbA1c is less than 7.3, then the contribution of fasting sugar is 30% plus or minus, and 70% for the postprandial. If a HbA1c is around 7.3 to 8, that means the postprandial contribution is at 53% and fasting contribution is at 47. So as the HbA1c increases, the fasting blood glucose contribution is more and the prandial glucose contribution is lesser. If a HbA1c to a given person is more than 9, that means 60% the blood glucose levels contribution is based on the fasting. The fasting glucose is contributing to the higher HbA1c and the postprandial is a 40% contribution. In a similar way, if the HbA1c is about 10%, that means there is 70% contribution of the fasting blood glucose levels and the postprandial glucose contribution is only 30%. So higher the blood glucose levels, higher the fasting blood glucose contribution. That means the doctor who is treating the patient will be looking at the medications to be given to arrest the fasting plasma glucose. So today the medications to treat the fasting glucose is different, and the postprandial excursions treatment is slightly different. Even the insulins are different. We try to use basal insulin for treating the fasting plasma glucose, and we use the bolus insulin doses to control the prandial glucose excursion. So SMBG is very important to further go into details and depth of a given treatment. And SMBG accompanied by structured educational program to facilitate behavior change results in improved outcomes. So how and when to perform the SMBG, how to record the results, the meaning of various blood glucose levels, all these help. And not only that, today many of the good glucometers have apps where you can log in your information, where you can log the data into the phone and then you get the graphs about what's happening, and in a short these things can be shown to the doctor and doctor can easily identify what's happening about with the low sugars or high sugars, and the time in range, what time the above range or below range can all be calculated and understood. So whenever there is a delay of food, what's happening to the blood glucose levels, or when the patient is having excess food, what's happening in a similar way. So all these things can be understood. So in case if a patient is having certain exercise, like say alternate day he goes for swimming, alternate day he goes for yoga. So that means the day on yoga, what are his blood glucose levels? The day on exercise or swimming, what are his blood glucose levels? Or when the patient doesn't go for exercise, say a person doesn't exercise on a Sunday. So on Sunday, what is his blood glucose levels? We can understand. Or a person 5 days in a week he eats in office and 2 days in a week he eats at home. So we can understand the differences between the home food and the office food, stuff like that. So sometimes we also need very close monitoring in people like type 1 diabetics or the gestational diabetes mellitus. So then we can understand in different times of the day how their blood glucose levels are maintaining. And there are patients who take insulin before each meal. So before each meal, that means we need to check the sugar before every meal and 1.5 hours after every meal to adjust good right dosage of the insulin or the medications. So as just now we discussed for type 1 and type 2, we can individualize and custom the way they test the blood glucose levels. So what are the important advices to patients on self-monitoring of blood glucose? Washing hands before checking your blood glucose readings is very important. Use a fresh lancet every time you check your readings. And for some people who can't change the lancet every time, who find it as expensive, they might use it carefully for few times. but ideally it is suggested to use a new lancet. Ensure the test strips are stored in a closet container away from direct heat and moisture. It's very important. Some people just open the container where the glucose strips are there and leave it like that. That's not good. You should immediately you take a strip and close it. It's very important. Never leave it. And some people have the tendency of counting the strips, how many strips are there. So when they do that counting, the touch is there, and if there is a wet touch, the strip may get spoiled. So, and also do check the expiry date on the test strips before using. Do not squeeze finger to get blood for testing. Gently warm the hands or rub your hands before testing. Squeezing can cause interstitial fluid rather than blood to come out, which might lead to improper results. And please avoid testing the finger tip where the nerves are located. And usually we suggest to take a left hand, the middle finger or the other finger for the testing. Accuracy is defined as the closeness of agreement between a glucose test and result and an accepted reference value. So it's very important to choose a very good glucometer. Unfortunately, nowadays many online companies and these chain pharmacies, they are trying to get their own glucometers from Taiwan. We really don't know the quality control and the durability of these glucometers. They are not time tested. So I request usually my patients to buy the best brands and which are globally approved, so that even when they go from country to country, the strips are available everywhere and easily accessible. And when you have a very good glucometer that is proven and approved, then even when a person is having different like a cardiologist, like a physician, then it can be accepted by other doctors as well. And the best brand of glucometers, they usually have good strips available, so you don't have variations in the glucometer, and accuracy is very good. So when some of the patients they say, sir, we are having a very cheap glucometer available, or we are having a very big discount on some glucometer, I said it's not about the cheap or discount. What you need is a good glucometer. If it is not functioning well, you will land up into again buying another one and you are going to lose the money. So usually when we talk about the differences, it's about up to 15% of variability, up to 15% of variation, which is still accepted. But I have checked many glucometers of good brands from strip to strip or finger to finger. When they complain, there is lesser than 5% of variation when you check when you recheck the test. So one touch Vario system demonstrate excellent clinical performances. So no effect on clinical action, and then the little or no effect on clinical outcomes, likely to affect the clinical outcomes. So there were criteria that they have been checking very intentionally and intensively so that the errors can be avoided. So we should be aware of accuracy when choosing a glucometer. As I was mentioning, it is a 9-year accuracy study from 2010 to 2019 done, included over 74,000 individual results from 729 production lots. Study was conducted in 3 national health services in the UK sites. Accuracy performed by one touch VarioFlex system at the lowest of 20 to 50 milligrams and highest of 400 to 600 milligrams extreme of glucose was 97% and 98.3% respectively. So this shows there is a very good accuracy in this particular study. ADA has changed words from self-monitored blood glucose SMBG to blood glucose monitoring BGM. So these are the important updates of ADA. The selection of type of device should be individualized based on a person and specific needs. In case of an individual whose diabetes is partially or wholly managed by someone else, then the caregiver skills and desire should be considered and decision to be taken on this. So it's a multifactorial approach to reduction in the risk of diabetes complications, and blood glucose monitoring is one of the important pillars for reduction of the risk of diabetes complications. So SMBG is a tool, not an intervention. So we teach the patients to monitor with meaningful outcomes, for better meaningful outcomes. So to summarize, SMBG is a cornerstone for the management of diabetes and help healthcare providers to assess glycemic control, adjust the therapy accordingly, help patients to modify lifestyle accordingly. Meaningful monitoring with the structured SMBG is an effective approach. The SMBG frequency should be individualized and assessed every time. Accuracy of blood glucometer is paramount. So accuracy of blood glucometer is paramount, meaning that it's very important that a patient gets the best glucometer so that they avoid confusion for themselves and they avoid confusing the doctor also, which is very important. The blood glucose monitor should have a qualify the ISO 15197 2013 criteria, which is very important. So thank you for your very patient listening.
Thank you so.
See, hypoglycemic unawareness has always been there, but it is nothing but a patient is in hypoglycemia, but he doesn't know that he is in a hypoglycemia. So, by especially when recently we started using the continuous glucose monitoring, we understood that some patients had low sugars, but they were actually not knowing it. So, when a patient experiences the low sugar and he knows that there is a low sugar, he sweats and then he checks the blood glucose levels is less than 72 milligrams, less than 72 milligrams, and then he takes an action to come out of the hypoglycemia. So that is, hypoglycemia is recognized. Hypoglycemia unawareness is something when the patient even doesn't know he had a low sugar, and then fortunately he had a hepatic glucose output coming, and then his blood glucose levels, they got corrected and he is doing good. But the patient is not knowing that there was a dip. So not knowing that there was a hypoglycemia is hypoglycemia unawareness. It is usually found in the people with long-standing diabetes and senior people who are more than 80 years of age and who have diabetes for last 3 decades, and also sometimes in the type 1 diabetic. So that is the reason why in this population we try to educate the people, and then we go for little more frequency testing in this kind of a people so that they have a good life of diabetes but also optimal blood glucose levels at the same time. How to motivate elderly people to go for frequent testing? In fact, nowadays it has become very easy. When a patient is having good trust upon the doctor, whatever you tell them, they believe and trust you and they obey very religiously. Unlike the younger age group who are very, very busy with their work schedules, they have to attend to so many online meetings. So whatever sometimes the doctor says, they miss because for them their online webinar is more important than what the doctor has asked you to do. You know, if a person, younger person who is very busy with his work, morning 3 a.m. he has a webinar, and I tell him kindly check your blood glucose levels before your webinar and after your webinar, he forgets that. No, I'm not blaming anybody. I'm just saying the attitude. So a person, when he knows it, then he can correct his attitude. That's why I'm just mentioning here. But when you have a senior person, when he says, when the doctor tells him, sir, next time when you wake up early morning for your passing urine, kindly try to remember to check your blood glucose at that point of time, 3 a.m. or 4 a.m. so that I will know what's happening within you. He will, if he misses one day, at least next time he will try to, remember what the doctor has said to them. For elderly people, doctor is a very important person in their family, because these elderly people, senior citizens, for them, their children, they're very busy. I'm telling some circumstances, and then either the children are abroad, like that. But it is the only doctor who is really concerned about this particular person 24/7 at all times. I have seen my senior people who had been with me for more than a decade or 1.5 decade. I'm more than a family member for them. I'm more than a family member for them. It's like me, if I can tell, it's like I am for them the Krishna who is telling the Bhagavad Gita, diabetes Gita. So they take my words very strongly and they take my words very closely. They follow me religiously. And when I think about this, when I feel that my patients are, giving me so much of respect, I feel that my life is a wonderful journey, and I'm fully satisfied with my life. I have nothing to, disagree with what I had in my life.